You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, the modern facelift, the new aging gracefully, according to my first guest. And we're also going to talk about minimally invasive and non-invasive facial rejuvenation. With us, we have board-certified facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, welcome to the program.
Hi, Randy. It's always good to be here.
Now, for people that don't know who you are, I mean, you've been on my show on and off for the last 14 years. And you look younger now than you did back then, so you must be dipping into some of your, some of the technology. Is that right?
In fact, yes.
Okay, good. So for people that don't know your center, I mean, who's your typical patient nowadays? Like age ranges, demographics, who's coming in for this?
Well, Randy, a lot of people come in from this, and they're really all ages. At 16, we may see a girl for a nose surgery or a rhinoplasty. As people get older, say into the 20s, we have models who have a little bit of stuff under the neck.
Like what? Like a fatty neck tissue?
There'll be a little fatty neck tissue,
Okay.
and there are different ways of handling that are non-invasive, injectables like Kybella and Cool Sculpt, or we can put a laser or a radio frequency device, Thermi, underneath there to take that out. And then as people get older, they start to look more at skin rejuvenation because they've been out in the sun a little bit. So different types of laser procedures can be very good.
Your spa is busy, by the way.
It is.
You were telling me, like it's like busier than ever.
It is. Non-invasive and minimally invasive things are growing at a rate of about 500% per year, which is incredible. People can stay younger without much pain, without too much expense, and doing very well.
Is your patient base getting younger and younger, or older and older, or both?
It's really all ages, Randy. It is. People get into the 30s, more skin type of work. 40s, we're starting to see some sagging, maybe around the eyes, maybe some fat underneath the neck, maybe a little bit of falling that can be handled by Ulthera or other non-invasive treatments. Well talk about those in a different show.
I mean, you almost have all the new stuff, right? In fact, I was talking about you behind your back. There was a plastic surgeon, and he said, well, Dr. Greg Keller, because he's over at UCLA and heads up the facial plastic program, he gets all the new stuff before we do. Is there some truth to that?
There is some truth to that. We've worked with industry for years and years, and it really helps us to keep abreast of all the non-invasive things. With all ages, we can make people look better. A lot of non-invasive stuff is happening right now to tighten the skin, to tighten the face. Surgery is still the best option.
For older patients.
For older patients, particularly, you can stave off aging with fillers and other types of laser treatments, but at some point, usually it occurs around 45 to 60, menopause and other things will take over, and then it's best done with surgery.
Yeah, and we should mention, because you have that Ulthera, which I love Ulthera, by the way, which I'm going to talk to you about after the show. I want to go down there and get it done. But is it true it kind of shrink wraps the face, like lifts tissues?
It does.
Is that true?
It does. It's actually FDA cleared for that. Now, is it surgery? No, but does it give a noticeable difference that 90% of the people are happy with? Definitely.
So the 60s and 70s, at the top of the show we said, this is the new aging gracefully.
That's right.
Really?
Yeah.
Getting something done, something...
Yeah, it's sort of a progressive thing as age goes by. And then finally there comes a time when the jowls sag a little bit, the cheeks sag, and gravity takes over because basically the face is a mask and it sits on the bone and the mask falls because it's held up by ligaments and everything else. So as that happens, we need to reverse that type of process. If we do it artificially, it looks odd. But if we put every structure back into its natural position, it looks natural and younger and more beautiful, and people don't notice the difference. Oddly enough, 30% of our practice today is men who want to stay active, who want to stay in the game, and want to look better. So who's coming in, Randy, is people of all ages. The girl who wants her nose fixed when she's young, the 16-year-old. The 20-year-old model who has a little bit of fat and loose skin under there that has to take modeling shots. The woman who wants to look a little better for her husband and feels like she's looking a little older and wants some filler or an Ulthera. And then finally you get to a point where surgery is the answer. So you have both men and women. Men are 30% of the people coming in and women are 60%. And these people often want to stay active with their jobs. They want to look better for their spouse.
Do they feel old? Or like not pretty anymore?
Well,
Like on the consult, what do they tell you?
they look mad, sad, and tired. And maybe their children or will say, "Why are you always frowning at us?" type of thing, or the people at work. So what you want to do is correct some of that, make them look younger, make them look less tired, because as we get older, we look more tired, even though today we feel very active. You know, I climb mountains and a lot of my patients do too. And so we want to stay with
Are
it.
you getting more of the so-called soccer moms? That means women that would have never considered any type of surgery. Are they coming in now?
We have a lot of soccer moms actually. Surgery, they do maybe brow lifts, cheek lifts, because the cheek falls more than anything else, fillers, things like Ulthera to tighten the skin, different types of things. Uh, it's more about 50 when they decide they want to do more facelifting than they would otherwise.
Now you have some great photos, by the way. And people need to know I'm not siding with you or endorsing you with this show. And I even tell other plastic surgeons, I say, the best photos I've ever seen are Dr. Greg Keller. I mean, you do good work.
Well, thanks, Randy.
But you do a different kind of a facelift, by the way. I think people need to know that.
We do. We do a structural facelift, and our pictures are good because they've been stolen all over the world.
What does it mean? What does it mean, by the way, a structural facelift?
Well, basically, the structures of the face fall. The face is a mask that sits on the bone, and it's held up by ligaments. And as those ligaments loosen, just like your shoulder ligament would, the face falls. And that looks tired, mad, sad, angry. The corner of the mouth droops. We get a little jowl. The cheek comes down. When we identify people, the FBI's done studies on this, and so medical, we look at their middle face, first the side of the nose, then over the middle face. That's the bling. So when we see that fallen, we think old, sad, tired, mad.
So are you kind of repositioning tissues up rather than back?
Yes, and we're repositioning them at all levels. Deeper tissue, muscle, all along the lining of the bone. And it seems difficult, but for us, it's another day at the office because we've done so many.
Good. Now I know you brought a lot of photos, and we're short on time. So what do you have?
Well, first of all, this lady is someone who felt like she looked mad, sad, and tired. Her grandchildren essentially looked at her and said, "Grandma, why are you so mad at us?" Every woman has a shoebox full of her driver's license and passport pictures and stuff like that. So this lady had that. And if you look at her pictures post-op, that's what she used to look like 15 years ago. And that's what we want.
Very nice.
But the way she feels is in there. She feels much better.
Well, I know you're humble about this, but it does look like it could be her daughter, or at least much younger sister.
Yeah.
That's fair.
So that's somebody in their 70s that's having this done. And if we look at the next one here, basically, she's around 50, and she had that. Women age all of a sudden. They say, all at once I became invisible. Okay?
Like invisible to people.
People don't notice people as much.
Okay.
You don't pay attention to them. And that's been looked at, studied, everything else. So she wanted to be looked at, and she wasn't going to let us use her pictures, but she walked into Trader Joe's and bought a bottle of wine, and the girl, who granted was only 18, didn't know the difference, carded her. And she said, "Oh, we card everybody under 30.
Is that right?
She really did.
That's good.
So she was pretty happy coming in. Look at the before.
All right.
You'll see that she has some sagging jowls. The cheeks have really come down. There's a crease in the middle of the forehead. So we have to correct all those little things. So we smoothed out her brow, we picked up her cheeks, took care of the jowl, and tightened up the neck.
And that's a facelift right there?
Yeah.
Because you would never think she has a facelift.
No, I don't think so. I think she looks pretty good.
What do they say, by the way, when it's all done? Like people like this?
Well, you know, we have a saying, how quickly they forget. They think they always look like that. And that's good. I like that because that's what's in their mind. They still look like themselves. So they don't think they look different. And usually what we'll do is we'll put a pre and post picture together and give it to them because that's the way that you really tell the difference.
And they're surprised?
They're surprised that that was them. They said, burn those. Basically.
Is that right? Burn them.
Burn the post-ops, yeah, or the pre-ops. Let's take a look at younger and older women and the neck, how the neck ages. If we look, there's a little pudge underneath the neck. It interferes with this young girl's modeling shots. So by correcting that, she looks good. Not much done. We put a laser underneath the skin and tightened the skin and got rid of some of the
So like
fat.
a laser under the skin might what? Kills the fat?
Yeah, it dissolves the fat, doesn't bruise her too badly, and very short healing time, but it also tightens the skin with the heat that's underneath there. And another person, you can
Wow.
see, again, taking out some of the fat, tightening the skin, but putting in a little chin to make that a little bit longer.
So she looks much heavier on the before photo.
Yeah, that's a natural type of thing. When you correct the neck, people feel like you've lost 15 pounds. They equate that with losing weight. So people may not even recognize that you had anything done. If you look at the before and the after, she looks much more sophisticated and refined in the after. I think it's a
That's
good
true.
look. I think it's a good look.
Because most people don't see themselves from the side.
That's right.
And as you say, that's the party shot, right?
It is.
That's how people see you
It
at
is.
a party.
At the reunion, whatever. Okay, here's another one. Job interview. You see the lump underneath the neck. That could be from muscle or fat or skin, and you can see the difference. So who are you going to hire? This person or this person?
Well, the person, I guess, that looks fresh and rested, with all things being equal. I guess that's fair. Right.
Absolutely.
All right.
More attractive people get more work.
Do you think there's like a discrimination that goes on when somebody looks old and tired? Seems like an obvious question, but I'm asking you as a facial plastic surgeon.
Oh, there's no question there's age discrimination. Why do you think I did a facelift?
All right, okay.
I want people to think of me as vital. I'm at the peak of my career where I know everything. My hands are good, my eyes are good, but I don't want to look old like I'm over the hill.
Now, we should mention, because you're in Santa Barbara and also at UCLA, but you know, and our show airs all over the US and all over Canada. And I've never met a plastic surgeon, especially a facial plastic surgeon, that doesn't know who you are. You're kind of known as like the innovator guy. Or, I mean, didn't you like one of the first guys to use endoscopes or endoscopic brow lift?
Yeah, we
right?
did invent the endoscopic brow lift. We had patents on it and worked with different companies very early on. That patent was the second to the last procedure patent that was ever given because somebody tried to enforce it, and doctors aren't supposed to keep other doctors from doing things. They're more for bragging rights and instruments. So yeah, no, we did invent the endoscopic brow lift.
Now, one of the most famous plastic surgeons in the country, I happen to know, went to you for their facial work. And I mean, do you get a lot of that? A lot of doctors?
We do a lot of doctors, yeah, that's true.
I mean, other plastic surgeons, right?
We do.
Okay, good, good.
Okay, so you look here and you can see that muscle band.
Mhm.
Every little thing about the neck needs to be corrected. She's not had a facelift, just had the neck done.
It's a subtle thing, but it's a big, big deal. I mean, when you look at it.
Look at the before, look at the after. She looks better with just a very simple type of procedure. Just a little sagging of the neck. This is sort of the soccer mom type of thing, doing a limited procedure that sort of straightens out the neck without doing anything else. So I think she looks better, and really it gives her a sense of confidence.
She looks younger. So what is that called? Just a neck lift? Or is that a facelift?
A neck lift, and there are different types of neck lifts that we do, 5 or 6 different
Because she had
types.
wrinkling right here on the sides of her face. That seems to be gone too. Was that with a combination of other procedures? Non-surgical?
She did have some fillers on the upper part of the face and some other things done, but not any face lifting type of procedure here.
Now, I always say that I could spot a facelift walking down the street or a neck lift. I've told you that, right? And you always say, well, not mine. But she doesn't look that so-called done. I mean, she just looks natural, like a natural beauty.
That's
I'm
the
trying
idea.
not to side with you, Dr. Keller, but these are good.
Well,
okay?
that's the idea. And you have to really work on different structures to do that. Now, here's a bit of more of a challenge. Guys are much more of a challenge because they have a lot of heavy structures in. And this, while he doesn't have a beautiful neck, you can see he looks like he lost a lot of weight. And that's what people thought.
He does look a lot younger.
Yeah.
That's like 8-10 years, right?
I
Is that
think
what
so.
you think? I mean, what do people say?
He looks better. I think that's the most important thing. He looks more with it, better, feels better. People look at him and think more highly of him.
Interesting. Well, he definitely looks like in the before. I don't want to put him down. He'll watch this show, but I would say he looks a little bit tired, maybe a little sloppier, and then the after he looks just like this
Yeah, some people
young
say
kind of dynamo.
Some people say they should just make a cut here and take it all out. We don't have to do that. You can hide some incisions underneath the chin and then in back of the ear so that you don't have this big scar running down there. Women like to look good with the head down, and this is an example of that. She's just had a neck and a cheek lift. I have a friend who's a wedding photographer. He shipped all over the world, and he says that a woman can pull her head back and smile faster than his flash can reach her.
Okay.
So women don't like to be caught with their head down. And so you can see the difference here with the head down. Here's another one that's a little further. Basically, the muscle and the neck is like a trampoline that's bounced on and it sags. So when we tighten it in some people, we have to tighten it from all directions. You can see when I pull on my cheek,
Yeah.
this muscle transmits its pull all the way through. This lady obviously has to have her tightening from all directions so that she can feel better, feel more confident, and really get up and go.
This is very nice, by the way.
Yeah.
Because it doesn't look done.
Now you can see the facelift incision here. She's going to be able to wear her hair up and that incision will become invisible. You'll never see that. So she has a bit of a facelift along with the neck so that her neck looks better. Her charisma and self-esteem, so much better. She's really out there more and feels better about herself. This is the face. And if we look, essentially everything's held up. As I said, it's a mask and the
What is
ligaments.
that right now, that yellow part?
These are cheek fat pads. There are about 5 of them that we had. And things fall, basically, because they're attached with ligaments. So as we lift this cheek, we restore the cheek, we restore the fat, we alter the ligaments in the face.
Is that called the mid-face? Like a mid-face lift?
This is a mid-face lift.
Okay, so the mid-face lift.
Yeah.
Is it true that a lot of guys, board-certified plastic surgeons, don't really touch that area very much?
That's true. Probably only 1 in 10 of us, but it's becoming much more popular. I just finished a textbook chapter on it.
None of the guys that I've been
received.
interviewing recently do that.
Really?
Now, what about putting fillers? Like when this drops, right? And then they just put fillers on top. Why is that maybe for certain people not a good idea? To just put fillers in that area? Because you like to lift it rather than just fill it. But doesn't it make it drop even more?
No, that's called camouflage. And the camouflage goes away after a lot of years or a long time or even a couple years. So what we like to do is put the structures back into position. Fillers can also look a little fake. We've all seen the puffer fish look that people get when too much in fillers are put in. So I like to restore things, make people look like they used to look. I like to see their old pictures to see where the structures were. Yeah.
And this next one, by the way,
Okay, you can see her
subtle, but
her cheeks falling down. So picking that up, cleaning up a little bit of the jowl there, straightening out the neck and lifting the brow a little on her. Little bit of a lot of things rather than a lot of any one thing, just to put her back naturally. So I think that you can see her mother and daughter did not notice the difference. You see it side by side. Even with the head down, here's the pre with the head up, post with the head down, and you can see the difference really. And again, very natural. Here's somebody, you can see that cheeks dropped even more. On this next one, I want you just to look at this part of the face.
okay.
Because that's an aging thing. Can you see how from the eyelashes down to the bottom of the eyelid, there's a big difference and things have really fallen.
Mhm.
As we pick that cheek up, can you see how she looks more rested, younger, but still very much like
And that's
herself.
a surgical procedure.
Surgical procedure.
So you went underneath and what? Muscles, fat?
Yeah, as I said, the face is a mask. We lifted the mask in all planes, in all directions.
Now, if I were diagnosing that before photo, by the way, like maybe a lot of my RN friends or they would have just put a filler? Does
Yeah.
it look like all she needs is a filler?
Well, if you do that, she's going to look not like herself or not like she used to look. And that's what I want. I want people to look like they did when they were younger and feel like they did when they were younger.
And do you think surgery gets a bad rap sometimes? Because there's so many people saying you'll never need surgery because all you need is ultherapy, which you have that technology. Or all you need is this other type of tightening, which you have that technology. But
Randy,
some people...
I love to do those technologies.
Okay.
It's very easy on me. But at some point, people get to the point where those technologies aren't really going to give them what they really want.
And that will last, by the way? So when you pick up these positions,
Years and years.
It'll be just like regular, like two twin sisters, right? This is a fair analogy. Two twin sisters. If you did that on one of them and not on the other, in 10 years, would one look noticeably younger, in your opinion?
Well, you know, I've done a lot of twins, and that's an
Oh,
interesting
really?
phenomena. Usually, if you do one twin, the other one will be in, because
Okay.
they're really that connected. So it's an interesting phenomena, anyhow.
But to answer my question, like you take them 10 years out, will one look noticeably younger?
Yes, no question.
All right.
Okay. Now, on this picture, here's a woman, 35 years of age, and here she is, 54 years old, 4 years after a facelift. And the goal is to show you that, yeah, she looks younger and she has more fullness at 35, but she still looks like herself at 54.
Okay, so that before is not necessarily a before surgery. That's her at 35 and now her at 54?
That's right. So you can see a couple things. One is you can't find her incisions. Her hair is up and back and she can wear it that way. And a lot of women worry about that, but it takes time to make the incisions good. And that's how I spend half the time of the facelift, is doing the incisions.
I picked you up at the airport. You flew in with your plane, and everybody's going, "You're picking up Dr. Greg Keller at the airport?" That's like a big deal, right? That's what my friends think. And but on the way over, you're telling me, because I'm, I was telling you about my personal life a little bit, and you said, "Well, I have a 70-year-old who looks 38." I said, "Dr. Keller, you got to be kidding me." I mean, is that true?
Actually, she's 77.
She's 77 and she looks 38.
Yeah.
I don't believe that.
She usually doesn't.
Respectfully, I don't believe that. I mean, really?
Absolutely. And, that's a function of her. But, her body's in good shape. We've cleaned her face up and she looks that young. She's just a good looking woman. I have another woman like that.
All right.
Who's 74, and we'll show you her.
Okay.
And that's like the decorator goes into the room and says, "This room has really good bones if I can straighten it out and clean it up." This next one just shows you how important the middle part of the face is. The FBI did studies, and when we look at somebody, we look first at the left side of their nose, then around their mid-face, and that's the bling that they get. If you look at this lady's mid-face, basically, since we did her post-op, you can see from the eyes to the bottom of the nose, she looks very young. She looks much younger. So fixing that cheek is very important.
In the after, she looks about 40. Are you allowed to say her age? Is she much older than 40?
She's much older than 40. Not much older, but
okay.
Yeah.
Now, we were talking in the car, and we were talking about defining beauty, and you were saying the confidence is beauty, the charisma is beauty, how somebody feels about themselves. That confidence is sexy. And for many of these women, they may not have the so-called classic looks, but it is sexy when a woman is self-confident.
Absolutely. And when a woman looks at herself as a young woman, she feels good. And then what happens to women is at a certain age, things go south, they say overnight, and say, all of a sudden I became invisible. I didn't attract the attention. And that may just be opening a door or holding a door. We're not really talking about anything else. She looks young, she feels good, she feels beautiful. People are paying attention to her. She became invisible. So what we want to do is restore that feeling that she has about not being
And do you see
invisible.
transformations every day? Is that a good word to use? Like, not only their appearance transform, but just they become different? Like they become younger, more engaged with life?
Oh, I absolutely think they feel better and get more active, without a doubt. The interesting thing was my mother was an art teacher, so I grew up with this type of concept. I never thought I'd be there. I was going to be a cardiovascular surgeon until I had an accident. But looking back on things, recreating what was there as close as you can, I think is what's important.
Good. Now we have time for like a couple photos. So I'm going to rush you, Dr. Keller.
Let's take a look at this woman. She just had a cheek and a brow lift. And you can see she looks more rested. And you can see the cheek has more of a convexity going into a concavity. I want to show you a couple as people age, though.
All right.
So let me just skip through. These are average results, driver's license pictures.
Average, you meaning like your typical patient?
In the 70s.
Because that's dramatic.
These are women in the 70s.
Okay.
And you can see the differences that occur for them. And these are very natural looking type of things that
These
we
are
do.
when you say they're in their 70s, could you back up for a moment? All those women are in their 70s?
Yes, yeah. So these are our average result. And of course, I want to show you my poster child. This lady is 74, and you can see how she has the classic things that we look at. You can see the jowl, the sagging neck muscle, how the cheeks come down, and all we're doing is picking those things up and restoring her. We're just cleaning it up and putting her back. And it's like when the decorator goes into a room and says, this room really has good bones, I'd just like to clean it up and put it back to the way it should be. So that's what we're doing here.
Wow.
With her. And then finally, a guy, this fellow, and honestly, in his late 70s, he's a good-looking guy here.
Yeah.
He says, Doc, I look like a haggard Hugh Hefner. So you can see that putting him back.
He just looks like a regular guy. He just looks much younger than he did before. In fact, he looked harder, if that's a word,
Yeah.
like a little harder before, like a tough guy.
He did.
Like you would cast him as a tough guy in a movie. Now he looks like just a friendlier almost.
Okay. Well, so this illustrates the sad, mad, tired look that people get when they age. So this is the correction of that. And sometimes it's good to do a nose surgery at the time of the facelift to really bring things back, because the nose falls with
So you
age.
just what, pick up the tip?
Just pick up the tip or take a little off. And it's a very simple procedure.
We are out of time. But final message, somebody watching this, they've got all the things you're talking about, the chin, the jowls, but they don't want to look done. They're still afraid. What do you say to them?
Go to our website, www.gregorykeller.com. This ebook is on there. Click on the ebook, and it'll show you that and more. And then come in for a consultation, and we can talk about what we can do for you in particular.
I want to thank you for coming on the show. Always a pleasure.
Thank you, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.